In this video, we are going to study aortic stenosis. Aortic stenosis. It is a valvular heart disease. Valvular heart disease. There are many causes behind aortic stenosis. So we will list the causes. The first is calcification. Calcification of the aortic valve leaflet. If there is calcium deposit over the leaflet, then the lumen or the valve apparatus becomes small and lead to aortic stenosis. The second cause is always rheumatic heart disease. It is always associated with mitral valve lesions. And third cause may be atherosclerosis of aorta. Whenever there is atherosclerotic lesions of aorta, it may involve the aortic valve also, which lead to aortic stenosis. And there is also a cause called congenital cause, which is bicuspid aortic valve. Actually, in this condition, there are only 2 valves instead of 3. So it is the most common congenital valvular disease, which is bicuspid aortic valve. So coming to the pathophysiology. Whenever there is narrow aortic valve, there is pressure build up in the left ventricle. Suppose this is aorta, this is aortic valve, this is left ventricle, this is left ventricle, this is aorta, this is aortic valve. Whenever there is stenosis, the pressure in left ventricle increases and lead to hypertrophy of the muscle. The lumen over the left ventricle become the muscle. Cardiac myocyte in the left ventricle, hypertrophy occurs. So in this situation, pressure overload in left ventricle lead to left ventricular hypertrophy, which is concentric, meaning it is toward the center. And if it is untreated, it may lead to left ventricular failure. If untreated, lead to LP failure. So coming to the clinical features, there is angina is present, because when there is hypertrophy, suppose this is left ventricle and there is hypertrophy, and between the cardiac myocyte, hypertrophic cardiac myocyte, there is coronary arteries. Whenever there is in systole, there is heart gets blood only in systole. So heart get blood in diastole. Whenever there is hypertrophy occurs, the muscles contraction occurs and it lead to constrict the blood vessels. So blood supply to the cardiac myocyte decreases and it lead to angina. And second symptom is dyspnea due to fixed cardiac output. And third symptoms is syncope. Usually it is exertional syncope. Mechanism behind it is in aortic stenosis, cardiac output decreases when there is increased exercise. When a patient with aortic stenosis perform exercise, lead to dilatation of blood vessel of skeletal muscle. As a result, blood supply to brain decreases, leading to syncope. These all are symptoms of aortic stenosis. And coming to the signs, first is pulse. The specific pulse pattern seen in this type of valvular lesions is parvus at tardus. It is specific for aortic stenosis. In JVP, there is due to, suppose this is heart, there is hypertrophy of left ventricle occurred. This is left ventricle, this is right ventricle. Hypertrophy of left ventricle has occurred. Due to this, the hypertrophic septum shift to the right side. As a result, right ventricular volume decreases, lead to increased pressure over the right ventricle, which shifts to increased pressure in right atria, and right atrial pressure lead to A wave, changes in A wave. Large A wave or is seen in case of aortic stenosis. Coming to the apex does not shift, but it due to sustained contraction, because left ventricle experience resistance, therefore there is sustained contraction of the left ventricle, which lead to sustained or heaving character of apex. Heaving or sustained apex. Sustained apex is present in aortic stenosis. And coming to the heart sound, S1, S2, S3, S4. S1 is soft in aortic stenosis, soft S1. Actually, in all the valvular lesions, there is soft S1, except mitral stenosis and tricuspid stenosis. In all valvular heart disease, S1 is soft, except mitral stenosis or tricuspid stenosis. Because S1 is soft, because when in aortic stenosis there is left ventricular hypertrophy, and due to this hypertrophy, the sound transmission is not effective. So sound transmission is not efficient. And regarding the S2, there is, since increased LV pressure due to stenosis, aortic valve closes later. So if actually in normal situation, aortic valve closes fast than pulmonary valve. So in this case that is aortic stenosis, aortic valve closes later, then there is reverse splitting occurs, which is present in severe aortic stenosis. Reverse splitting. Reverse splitting of S2. Regarding the S3, usually S3 occurs when there is left ventricular failure, and so in case of aortic stenosis, it may present or absent according to the severity of the disease. And S4 occurs due to due to pumping of blood from atria to ventricle when ventricle is steep. So steep meaning whenever there is left ventricular hypertrophy, LVH. So since it is present in aortic stenosis, so S4 is present. And regarding the murmur, it is always ejection systolic murmur. Ejection systolic murmur, and it is situs over the aortic area. Because see the diagram, this is aorta, this is valve, this is left ventricle, this is sternum, this is left ventricle, this is aorta. So when blood ejects through the stenos aortic valve, there is murmur present. So see the diagram, the blood is pumping right to the sternum and it is present in second intercostal space in parasternal line. So over the which is aortic area. So it is site of the murmur is the aortic area. Regarding the radiation, there is a regarding the radiation, the aorta bifurcates. It is common carotid artery, right common carotid artery. So whenever blood flow get gaps to the and free pathway to the common carotid artery, then there is radiation present in case of aortic stenosis, and it is carotid in neck. These all are signs and symptoms of aortic stenosis. Regarding the investigation, first, in all the case heart diseases, we have to do ECG. In ECG, we can find pattern for LVH or LV failure. No, not exactly LV failure. We can get signs of strain pattern, plus signs of LA enlargement, and we may get left axis deviation. The criteria for LVH is usually, since left ventricle can be denoted by C-slit P5 or P6, if height of R wave is more than or equal to 25 millimeter, then we can call it LVH. And strange patterns mean in P5 or P6 we can get ST depression plus T wave inversion. So it is called strain pattern. On chest X-ray, no cardiomegaly present, and echo, that is echocardiography, there is narrow aortic valve, that is if less than 1 centimeter square, it is called severe aortic stenosis. Normally aortic valve leaflet diameter is 3 to 4 centimeter square. If it is less than 1 centimeter square, it is called severe aortic stenosis. And regarding the treatment, this is aortic valve replacement. It is surgical. Basically, treatment is divided based on NIHA classification. NIHA symptoms, New York Heart Association symptoms, which include chest pain, dyspnea, fatigue, and palpitation. If patient is asymptomatic and if patient is symptomatic, we have to do left ventricular function assessment. That is left ventricular ejection fraction. If it is more than 50%, conservative management. Active management is done. If less than 50%, there is surgical management. And if it is symptomatic, it is always surgical management. So this is all about aortic stenosis. Thank you.